So, Courageous Access audience, this is the conversation I could not wait to get to you. We had to get everybody's schedules together. And of course, you got to check marketing stuff or whatever, but we got this, and this is so important. So, as Black women, there's a piece of this whole domestic violence puzzle that a lot of us probably are missing. And I will say I absolutely was missing it. And that is, what is our status after? Like, there's all that stuff we have to think about and rebuild, but we're not going to do anything if we don't have our health. And we need to know what the status of that is before we're moving into other relationships, having other children, and all of that. And so I told you guys, those of you who were at the Empowerment Art Showcase last year during Domestic Violence Awareness Month, I told y'all I was going to get my status, and I did. And thankfully, I came out negative for HIV, but here's the thing. If I had been positive, I still would be okay. And I want you to know that, and I want you to know how that would have been possible. And so I am bringing primary health care to you today, and I'm going to have this amazing conversation with one of their nurse practitioners whose name is Becky Johnson, and we're going to find out what you can do to not contract HIV. We're going to find out how you can find out if you've contracted it, and then we're going to find out if you're positive what you can do. Wow. So here we go. So I want to do justice to who I'm going to be talking to today. So Becky, would you please tell our audience who you are, your actual title over there at Primary Healthcare, and then what that means that you do on a daily basis?
I'm happy to be here, Courageous. My name is Becky Johnson, and I am a nurse practitioner. I work at Primary Healthcare. I'm an HIV specialist accredited through the American Academy of HIV Medicine, and I am the clinical director for the HIV, STI, and hepatitis services at Primary Healthcare.
So, like I said about our organization, Becky, like we're not those people that do the work of like the National Domestic Violence Hotline. We're not the ones that center on the crisis during the abuse. We want to catch folks after and help them rebuild. And so one of the biggest misses that we've had for 5 years now is, how do I know if they left me something? How do I check my status after I'm no longer being sexually active with the abuser?
HIV and STI testing can be done anytime and should be done regularly if there are regular exposures. Keep in mind, though, that there is a window period where if a test today won't tell you what happened last week, for gonorrhea, chlamydia, syphilis, HIV, there's various window periods that are anywhere from 2 to 4 to 6 weeks. So if you get tested, knowing your status at any time is great. But if you've had an exposure in the last 2 to 4 to 6 weeks, we recommend being retested for all of the STIs and HIV to close out that window period.
We talk to our clients and our audience a lot about the fact that being in a relationship with someone does not mean that there is this through line of consent. There is such a thing as sexual abuse within an intimate partner relationship. And many survivors talk about the fact that during the relationship, and I definitely was one of those people, that there was what we call the death walk. You have to go into the bedroom at some point during the day. You try to outwait them. You try to wait till they go to sleep. But at some point, you're going to have sex with them. They're going to require that. When you know that and you're being sexually abused in the relationship, are there ways that you can protect yourself? And if so, would you walk us through that?
Courageous, you mentioned the death walk, and that was very moving, very terrifying. And so yes, I agree that any information we can give women to protect themselves when they may not have control over their own bodies all the time is so important. Their condoms and lube are very effective for preventing STIs and HIV if used very consistently and every time. And if that's somehow difficult, if you're not in control, then there's also what we call PrEP, or pre-exposure prophylaxis. And that is a medicine that women can take every day, almost like birth control. I sort of often compare it to birth control. So it's like a pill a day keeps the HIV away. And you take one pill every day, and women have to be on it for 3 weeks for it to build up in their system. And then it is very effective in protecting, kind of puts a barrier around the cells that HIV attaches to, and so it can prevent infection. And so that is a really powerful way that women can protect themselves, and the man doesn't, the assaulter doesn't need to know about it, or that they're on it or anything, and it's all in the women's control. There is another option also called PEP. So PrEP stands for pre-exposure prophylaxis, and PEP is post-exposure prophylaxis. So if someone is assaulted, they can take PEP. If started within 72 hours, it's a regimen that's a full regimen for HIV treatment, taken for a month. But it is time sensitive. It needs to be started right away after an assault or an exposure, and no later than 72 hours. And so we always recommend anyone who's been assaulted contact either the emergency department, where they can access this medications, and reporting the assault to, and they can get put in contact with someone to get these medications.
So one of the things we talk to our clients about also is helping them to get comfortable enlisting their children and educating their children on what abuse is, so that they can be a part of stopping or putting up walls or barriers to the post-separation abuse that abusers usually try to worm in through the children. Well, my children were very educated. I worked very hard on that. And they said to me one day, "Mom, where was he going for all those hours that he was supposedly mad at you? Like, he was gone for like 5 or 6 hours at a time, and then he just comes back home. Where was he? Who was he with, Mom? Do you even know if he left you something?" And I thought, Lord have mercy, I didn't even consider that. So for our clients who are at that stage of, it dawns on you now that a little smoke has cleared, that perhaps you should know your status. Is that a different process? And if so, walk us through that.
I recommend anyone who's been sexually active, get tested for all HIV and STIs, no matter how long it's been since their last exposure, because it's just good to know the status. And as I mentioned before, there are window periods and incubation periods for some of the STIs. So if you've waited 3 months or 6 months, it's fine. It's, that make sure we'll pick something up from that encounter that was previous.
We don't necessarily do a lot specifically with sexual abuse from unknown assailants, but unfortunately, a lot of our clients have that type of crossover. And so when it's someone that you did not expect, you don't know them, you don't know what their status is that a different process, especially when I'm talking about the whole forensic exam and all of that? Should that look different, or would they go through the exact same process simply because they want to know their status? Help us know the difference for those who know that they are sexual assault survivors and also want to know their status.
No, it would be the same process. Whether you know your attacker or your assaulter or you don't, you often, you never know what they might have, and they might not know what they might have. So it's the same thing. You should just be tested for everything, and make sure you know your status.
Okay, this is the big one. People always dread it. What if I'm positive? What if I follow all the steps and go through the testing and then I find out I have HIV? Is there a way to annihilate, bring that level down, and be able to go back to what feels like a normal sort of life? Talk to us about that.
It's very important for people to know that The treatments for HIV have improved so much, and HIV is not a death sentence anymore. We have very good treatments. At primary healthcare, we offer same-day HIV testing and results, and we can connect people with medical care right on the spot if they test positive. And I tell all of my newly diagnosed patients that an HIV diagnosis does not have to change your hopes or your dreams or your goals for life. You can have a healthy sexual life when you're HIV positive. You can have children when you're HIV positive that will be HIV negative. You can do and be anything that you want to do and be. HIV does not have to limit you because it's controllable, it's manageable, and we have a big support team for you at primary health care to help you navigate all of that.
One of the things that, of course, I was concerned about when I got my status in November of 2024 was, okay, but I don't know what else he could have dropped off besides HIV. Like, what else could he have done? And so when they want to not just know their HIV status, when they want to make sure that they don't have other STIs, where do they go? Is it all in that same space, in the same visit? Should they plan for additional visits? Kind of help us understand that part too.
There's a lot of different ways to get tested for STIs. There is routine HIV and hepatitis C testing recommended for everyone, basically. And so if you just go to your doctor's office and ask for the test, it should, we try to take the stigma away from asking for a test and just saying everyone should be tested at least once in their lifetime. And if you've got reasons to be tested more often, then that's fine too. And you can get tested with your medical provider or at primary health care. Of course, we have primary care providers, but we also have outreach testing. So you can come in confidentially, get free testing, same day HIV results, also do testing for gonorrhea, chlamydia, syphilis, and those go out to the lab, so they take a little longer to come back. But it's available, all the testing is available here, and we try to make it really convenient and free and confidential. If the test is positive, it would have to be reported to the health department to make sure that you get connected with care and that other people that may need to be tested can also get tested.
So let's say they've gotten their status for HIV. Now they do know their status about STIs as well. What about those? What if they are positive for any of those? Does someone pick them up right at that time? Like when they find out that they have some STI, does the same person that notifies them also tell them, it's okay, we've got help, this is what you do next? Or is there a space in between? And really, that kind of goes for the whole thing. Anything that they find out that they're positive on, like that's what they have. Let us know if there's a break in between where they kind of got to nail bite it out, or if there's actually like right then, right there, they know they have help. Talk to us about the hope part, Becky.
Yes, there is hope. If someone is tested positive for an STI or HIV, there is absolutely hope. And, gonorrhea, chlamydia, syphilis, trich can all be cured pretty easily with medication. Whoever orders the testing will get the results of the testing and will notify you of the treatment plan and provide the scripts and supports needed. And as I mentioned before, if it's a positive HIV test, if you get it done at primary health care, you can get, like I said, a direct warm handoff to a medical HIV specialist like myself or my colleague Leah, and we can get you started on medications same day.
And my last question today, Becky, you've been amazing. And so I just want to know, even, for folks who don't think that they necessarily have anything, but they know that they're sexually active and they just want to be careful. They just want to keep up with things. What should they do? And then how often should they do that?
So anyone who's having unprotected sex or has sex with new partners or is assaulted should be tested. And so, the frequency of testing really depends on your exposures and your situation. A lot of people get tested regularly every 3 months get tested. If you're on PrEP, the pre-exposure prophylaxis prevention, we will want HIV testing every 3 months, and then we also offer all the other STI testing at the same time. But yeah, if you are sexually active, and you should get routine testing.
So guess what? We done said all this stuff about testing. Child, we going to have testing on site 3 times in 2025. Yes, there are places that you can go. We talked about it where you can get testing. There's stuff around this video, but we want to make sure that you can be in an environment that you feel comfortable with. We know how you feel about us, and we feel the same way about you. Primary Healthcare has hooked us up with 3 different dates for testing. So aside from all the other stuff you're looking for, make sure you're watching for those dates. As a matter of fact, you should see them rolling across my face right now. Look at those, save those on your calendar, and then you'll be able to come right here. Where are we? We are at 501 Southwest 7th Street, downtown. We're in Suite G like George. And if you're trying to Google map it, Des Moines, Iowa 50309. And by the way, that's where you can pick up other stuff right there in the lobby during business hours. You don't even, it's a secured building, but you don't need a key or to buzz in just to pick up stuff out there in the lobby. So anytime during business hours, Monday through Friday, that you want something from Courageous Access, just go and stop through there. But for the testing dates, save those dates and then come see us at that location, and we got you. Wow, if you've been watching this, there should be something around this video where you can get more information. I cannot tell you what a load it takes off your mind when you know your status, right? When you think about being a survivor of domestic violence, there's so many weights that you kind of have to drag along for a little bit until you can start dropping things off. Sister, this is one of those things that you can drop off quickly. And so click around this screen, around this video, find that link. Don't be afraid, because as you saw in this video, no matter what the answer is, there is help, there is hope, and you have agency, sis. So this is one of those situations where we're giving you your power back, babe. You have permission to take care of you. Grab it. My name is Courageous Fire. This is Courageous Access. You know we love you. Take care of yourself.